It is Go Acadiana with Ken Romero and Dr. John. 20 minutes after 5. John, introduce our guest.
Hold on a second now. I'm still getting my groove on. This is Giorgio Moroder, the famous Italian composer who basically invented this drum beat.
Yeah.
All right, now I got my groove. All right, now I'm ready.
All right. I thought you were playing Donna Summer on me or something like that.
This is Donna Summer. This is I Feel Love.
I know it is. I just didn't want you to sing.
I roller boogied to this in the 6th grade with bell bottoms on, sparkly stuff on. We've got Treasurer John Kennedy with us. Tell me you didn't roller boogie to this, too.
I don't think I've ever roller boogied in my
In your life? Oh, come on now.
I miss that's the part of my youth I miss.
And John, you got to admit, thinking of John in sparkly bell bottoms enough to scare you right off your skates.
Listen, I was an attractive young man at one time in my life.
What the hell happened to you?
I know, no one ever believes it. Well, it's good to have you here.
It's good to be with you.
What are you doing on the road traveling around? I was telling Ken, John must have ran out of gas and just said, hey, I'll come in here and hang out with us for a little bit.
Usually I'm calling in. It's nice to be live.
No, it's great to have you
studio.
here.
It's good to be live.
So we're talking about a med school in Lafayette?
It's possible.
All right.
We certainly need a new med school.
Yes.
If you look at the numbers, over a third of our population, well over 1 million people, live in a federally designated primary care shortage area.
Sure.
Every year we produce between LSU and New Orleans, Tulane, and LSU and Shreveport about 450 physicians, but they don't all stay in Louisiana.
Right.
Tulane, if you look at Tulane's class, out of 177 graduates year before last, only 35 stayed in Louisiana.
Mm-hmm.
Wow.
And with all of us getting older, with more people having insurance.
See, he looked right at Ken when he said older.
I know.
Not everybody out there can pick up, but go ahead. He looked right at you.
But Lafayette, I mean, this much I know. We need more doctors.
Right.
We need another medical school. Obviously, you have to pick a place, and Lafayette makes sense, in my opinion. It's got a very sophisticated, accomplished medical community. You have the hospital infrastructure with Lady Lords and Lafayette General and Women's and Children's and the Regional Medical Center. You've got a world-class university, got a thriving economy. We had a meeting yesterday. Mayor Joey Durrell is our quarterback.
Okay.
He called the meeting. We had about 50 folks there, good cross between elected officials and hospital executives. We invited Dr. Larry Olye, who's chancellor of the LSU Medical Center, to come in, and we're going to try to put this together.
I've got a question, and I don't mean to be flip about this.
No,
but do excuse me. Do you think any of the doctors, when they come out, will sue for depriving them of the pleasure of seeing so many gunshot wounds in New Orleans? I just wonder, because we don't have the crime rate they've got in New Orleans.
Well, if you look at the demographics of our state, one of the first things you notice, Ken, is that while we have a great medical community in Lafayette, for example, in a lot of rural areas, they don't have physicians. They have no primary care physicians. So what we need in our new med school is to focus first and foremost on primary care.
Mm-hmm.
Right.
We could do it. Now, med schools are not cheap, okay? The last one that opened was opened last year at Quinnipiac University in Connecticut. Spent over $100 million. We can do it for a fraction of that cost in Lafayette for a number of reasons. We already have the hospital infrastructure. We already have a world-class university. We already have the faculty.
Right.
We don't
Absolutely.
we've got practicing physicians. We don't have to bring them in. If we do this, we're not going to take money. We're not going to raise taxes. We're not going to be taking money away from any other school. We're not going to be taking students from any other school. This is going to be value added.
Hmm.
But I can tell, and I understand every community would like to have the med school there. We don't have the money to put one everywhere. We got to pick a spot. And to me, and I know this upsets some of my colleagues and friends in other parts of the state, but you got to make a decision. And Lafayette is the cheapest, best place right now.
When you're looking at, say, demographics and population trends in the state, the parts of the state that are declining in populations are the places where there's the largest health disparity.
That's right.
But locating a medical school in the Delta along the Mississippi River doesn't reach out to the population that it will service. And also, I think having something in Lafayette means that these doctors that train here are more likely to stay in the community because they love the community.
That's true.
You look at the population of Louisiana in the last 10 years only grew by 61,000. 32,000 of it was in Lafayette Parish alone.
You're absolutely right, Doctor. You're absolutely right.
Well, we have a crackerjack research staff that we keep in the basements here.
They're wet most of the time.
They're astute and brilliant. But if you look at that means it's the natural place for a medical school.
Well, you also have to have, and it will only work in Lafayette if we have a coalition of your political community, your civic leaders, your business community, and your medical community. That's the only way it will work. But Mayor Durrell is an excellent quarterback. He's taken control of this thing. Our meeting yesterday lasted probably 3 hours. Of the 50 people there, probably 30 spoke. I didn't hear a negative comment in the whole time. He's kind of split us all up. We all have our assignment. It's important we get started because you don't just announce a med school on Monday and have it going by Friday. As you know, it'll take us a couple of years. You got to get national accreditation.
Right.
But this I know, Lafayette makes sense, and I know this will help Lafayette, but it'll also help the whole state. We desperately need physicians.
And you said one of the magic words. Well, not a magic word. No taxes. No new
That's
taxes.
Right. We're not going to take money away from anybody. We're going to figure out a way to do this. We're pretty far along in terms of the financing. I'm not ready to talk about specifics, and it's not my place. Mayor Durrell would. But a lot of thought has gone into this. A lot of folks have been working hard behind the scenes. Senator Freddie Mills is going to be involved. We have a great delegation from Lafayette, I can tell you.
Absolutely.
But Freddie has he probably knows more about health care in the legislature than just about anybody.
Sure, that's right.
And so we've gotten Freddie's going to be involved, and Paige Cortez and Nancy Landry and Joel Robideau and Dee Stanley from the mayor's office, and Joey was there, of course, Mayor Durrell, and we had the executives from every hospital in the area. They're very supportive.
Sure.
Dr. Olyade, who happens to be from Crowley, by the way, he's the chancellor of the Health Sciences Center for LSU, but he did a wonderful job. So we'll see.
One of the things that we've seen, too, increasing, in order to get health care out to the rural areas, because this is something that we'll still need to address this increasingly, and this is why Lafayette is so good, because of our fiber network.
Yep.
We're able to transfer and get data from health records across the region.
Man, you're a smart guy. That's exactly what was talked about yesterday. That's great.
I didn't go to school for 28 years for nothing.
That's one of the
It's an
pluses.
easy way where you can do off-site analysis.
Absolutely.
Yeah.
One of the things that was pointed out, the other strength that Lafayette has is UL, major world-class university, which will play a huge integral part of this, will be an equal partner in it. I'm not saying other areas of the state aren't important. I'm just saying what's the best place in terms of what's there already and would cost taxpayers the least amount of money. And I think if you look at it objectively, everything from the telecommunications to the universities to the medical community,
right.
Lafayette makes sense.
Right.
Now, I'm not naive enough to think that everybody's going to agree with that. You'll have some other areas that are going to ask some tough questions, but if we do this right, we'll have the answers.
I know you mentioned all the hospitals that are involved. You did not mention specifically building a physical structure.
No, absolutely not.
Because the question was going to be, why should we build a new building considering Bobby Jindal just sold off a bunch of state hospitals?
No, we've got the hospital infrastructure. We've got Lafayette General. We've got Lady of the Wards. We've got, I hope I don't leave anybody out, Women's and Children's. We got the Regional Medical Center. We have some specialty hospitals. We have the infrastructure. We've got the faculty. Some of the best doctors in the world are right here in southwestern Louisiana.
Absolutely.
We don't have to bring anybody in.
Right.
It would be a 3-year program. Something new. Other states are doing this, but that will save money. In other words, the student med school, as you know, is normally 4 years. There would be no summer vacation. These kids would go 3 years. That's going to save money for the state. It's going to save money for the kids because med school tuition is about $18,000 a year.
Wow!
So if they can cut off a year with living expenses, they can save $25,000 or $30,000.
Great.
Yep. And it being close enough, sort of equidistance between New Orleans and Houston means that it becomes like a regional hub for healthcare in an area that really, in many ways, already is a regional hub. So it's perfectly located.
Well, Lafayette's been called a hub city for probably close to a century now.
Now the hub of health.
Absolutely.
Well, but I mean, I want to emphasize this is we're in the formative preliminary stages. For this to work, we have to get accreditation. We have to convince the political leadership in all of the state. It's only going to work if the business community, the civic leaders, the medical community, the university community, if we all come together. But we have a great quarterback in Mayor Durrell, and of course Dee Stanley is administrative assistant. We got a really strong legislative delegation.
Mm-hmm.
I would put the Southwest delegation up against any. So it's possible. It could happen. This much I do know. We need it.
Yeah.
Wherever we we need somewhere, we need a new med school. We need more doctors.
Absolutely.
Fantastic. Well, thank you so much, as always.
Thanks,
Great
guys.
having you on, particularly in person. It's always wonderful to see you.
Great. You look like you've lost 10 pounds since I saw you last.
I've been eating less and working out more.
Well, that's good.
I bought an elliptical trainer and put it under my carport.
Do you hang
because
clothes
it was too
on
heavy
it
to
or
get
something?
upstairs, so I work out in the heat. And you work out about 45 minutes in summer heat in Louisiana, and you're ready.
Well, I'm glad you're doing that because
Look good.
I'm not. No way, man.
Hey,
No
thanks for
way.
joining us.
Thank you
Thanks,
very
Doc.
much.
Thanks,
Appreciate it.
Ken.
Treasurer John Kennedy joining us on Go Acadiana. It is Go Acadiana with Dr. John and Ken Romero. We'll be back. Got Todd Starnes and Laney Lee Cook with news coming up next at KPEL.